Reduce the visible signs of aging without going under the knife. Our next guest wants to help you get back that youthful facial appearance that you once had. Joining us once again is Dr. Pentel. She is a board-certified dermatologist at the Spa and Laser Center at Southside Dermatology. And she brought along with her Shelly Thomas. Ladies, thank you so much for being here. And Shelly, we're going to get into you in just a second and talk about why Dr. Pentel brought you from the office today. But first, Dr. Pentel, let's talk about this thing called liquid facelift. I can hear like the angels singing. What is a liquid facelift?
Sure. A liquid facelift is lifting, plumping, filling, and recontouring using a combination of different types of fillers and Botox and Dysport and Xeomin. It's called a liquid facelift, Casey, is because we're using liquids and semi-solids to lift saggy skin. It's a safe and non-surgical alternative to a traditional facelift. Because what do we do with traditional facelift? We're trying to get rid of the wrinkles, right?
Right. That's the ultimate goal, but you have to go under the knife to do a traditional facelift.
And some people are not ready for that, and they don't want that yet. So this is an alternative to that. And it's very, very safe and can last several years, especially with the new fillers that we have.
Okay, lasting several years. And that people like to hear that, because if they're going to go in and they're ultimately going to get shots, right? That's what it would entail. I know you do a lot of numbing, but it would entail that. They want it to last for a long time. Let's bring Shelly into the conversation. Why did you bring Shelly here?
Well, Shelly, how old are you, Shelly?
I'm 37.
Okay. So, Shelly, what are you looking for to improve in your appearance?
I would love to get rid of all of these lines.
Okay.
And also under my eyes, it's starting to get darker.
Okay, yes. So what would you recommend then? She would be a perfect candidate for the facelift, the liquid facelift.
Well, yeah, she's a little bit young for that, but with a liquid facelift, you can use a little bit of the neuromodulators to help her lift her eyebrows a little bit. And as you age, you have to think about different how we age. We have bone resorption, so as we get older, we look sunken in. And then we have these fat pads in our face, like right here, so you get temporal wasting. And then you have these fat pads here, so if you lose that, you get that sunken in kind of dark circle type of look. And then if you start losing fat pads in your cheek area right here, then you smile, Shelly, you start getting these wrinkles because you don't have that support for your skin, so it starts getting saggy. And then you have fat pads here, and the fat pads here, then if you lose that, you start getting, like, she doesn't have it, but a lot of people get that droopy, kind of puppy-looking kind of look, right here.
Something resting face that we won't get into the name of that. That's true. If you Google it, it actually does exist.
I didn't know that. Okay.
Just prepare yourself. We talked about it on the chat a long time ago.
So if you fill all this stuff, then we'll give her love. And we use different type of things, because not every fillers are the same. I use all of them because they have different properties. So if you want to have lifting and you want to have support, you want to use something that's more viscous, more solid, more firm. If you want to use something that more integrates into the superficial dermis to help with more superficial wrinkles, you can use that. Because you know that at age 25, we stop making collagen. So every year after that, we use 1 teaspoon of volume.
Why does it have to be 25?
I don't know. We use 1 teaspoon of volume, so we need to fill that and put that back, you know.
So that is what you're doing, and you're saying that this can last several years.
Yeah, with the new fillers, because Bellafill just got approved for 5 years, you know, and so you can use different fillers. You can use the collagen stimulator, which is your Sculpture, Radius, and your Bellafill. That stimulates collagen, so your own collagen, to last longer. Then you have your hyaluronic acid, which are your Restylane, your Pearlane, your Juvederm, Volumina. And that's a little bit shorter, but it can help you, especially people who are afraid of fillers, because I can use an enzyme to inject in there for some reason if you have a reaction you don't
Bottom line is it's not one size fits all. It's very tailored to what you want to be able to accomplish on your own face. So let's take a look at some of the before and afters, and then you can kind of walk us through what we're seeing there on the screen.
Sure. She has a lot of, you see, like Shelly with the wrinkles around her cheek area, and she started getting those infraorbital hollowing. And if you can look underneath her mouth, she's starting to have that pre-jowl sulcus too.
And so then there were some fillers that were involved then in part. And then talk about this lovely
lady. She's a little young, but she still looks better, right? Because she didn't like that pre-jowl sulcus. She started feeling like a little bit droopy. As you can see, you could bring her mouth up a little bit. And underneath her eyes, she's starting to have that infraorbital hollowing that we call. And some people say, they come in and they say, okay, it's dark circles, but it's really volume loss that we're seeing.
Okay.
And this is just overall volumization. She just didn't like all the wrinkles. And sometimes we can do a lot of this with lasers and therapy and different procedures. But stimulating the collagen overall is also a good idea.
Okay, so if somebody wants to come in, well, unless, I don't know how many more we have of these, but...
This is the last one. Yeah, same thing, just volumization, lifting her wrinkles, making her look more youthful.
Okay, if somebody wants to come in and sit down and go over this step by step with you, get a free consultation, here's what you need, you know, this, that, and the other, you also have a special incentive just for First Coast Living viewers.
Yes, because I'll be honest, I hardly ever do fillers specials, but right now we have a 20% of all fillers, including Bellafill, Bellatero, Restylane, Pearlane, line, Voluma, Radius, Sculptra. So please come in. Let me help you assess what you are concerned with. And hopefully we can give you a liquid facelift.
All right, and Shelley, you're coming back after you get the part of the procedure done, and then come back and we'll reassess.
Absolutely.
All right. Well, thank you, Dr. Pentel.
Oh,
We
my
appreciate you
pleasure.
as always. Shelley, thank
My
you so much
pleasure.
for being here. And we'd like to thank the Spa and Laser Center at Southside Dermatology, of course, for sponsoring this segment. You can learn more by visiting the spaandlasercenter.com, or you can also call them at 904-400-7772. The number is right there on your screen.